But I believe that you had put up a post that maybe one of your friends is possibly dying from cervical cancer.
Died last
Oh,
week.
they died. Oh, I'm so sorry.
Yeah, last week.
Mm.
This is actually someone, the parenting forum that we were discussing your case on, that I talked about at the beginning. This is a friend from that parenting forum. Yeah, so I knew her online for, how old is my oldest? Is 15 now, so it's been about at least 15 years.
Wow.
Yeah, it was a bad situation. She didn't have healthcare insurance for a period of time. Hadn't seen the doctor in several years, did finally get in to see a gynecologist after having some symptoms. And she had a tumor, she had a hysterectomy. This is something that should never happen in 2021 in the US, but here we are. Yeah, she passed away last week. So everyone, get your children vaccinated for HPV.
Boys are both fully done. I mean, the one thing I can't, it bugs me because parents are like, why are we giving them the HPV so young? And it's like,
that's the whole point. You do it before they have sex.
I mean, I don't, it's like they're going to have sex at some point in time. Yes. Mm-hmm. Okay. So give them the jab now and finish the series and no worries. We're done. Just wrap it up. Sorry, that too.
No, both of mine started their series at 9. We're finished by 11, I guess. So yeah, both of mine are fully vaccinated too. But that was one of her final wishes, was that everyone get their children vaccinated for HPV. No one should have to go through what she did.
Yeah, I was going to ask you about HPV because I feel like, I don't want to say there's like misinformation about it, but maybe things have been kind of like updated over the years of, you kind of hear about, but you don't hear about it as much as it probably should be talked about and shared about. So how young can you vaccinate your children?
9 is when it starts on the schedule. Yeah, for the CDC schedule. And it's only a 2-shot series now when they start that young, which is great. It's also now FDA approved to be vaccinated up to age 45, I believe. Your insurance might not cover it, unfortunately, but it is approved for that. So I highly, recommend that for everyone too. I'm too old, but but I think it's great for everyone, men and women. A lot of oral cancers, squamous cell carcinomas are related to HPV. I mean, we have a vaccine that can prevent cancer. I mean, it's amazing.
Yeah. Do you know if there's anything that could happen or anything in someone's history or medical history that would not make them a candidate to get the vaccine?
No, honestly, off the top of my head, I can't think of anything. It's not a live vaccine, so there's no contraindication for any sort of immune issues. No, I can't think of anything.
Okay, because I seen somebody, when I was going through your post, I seen somebody say something about an abnormal pap that they had, and they were like,
absolutely not a contraindication.
Okay. Because I was kind of like, well, if you had an abnormal pap, wouldn't you still want to get the vaccine? Like, you know what I mean? And she's like, oh, I couldn't get it. And I thought, but that means you want to get it.
No,
like,
even if you've had HPV found on a pap smear, you would still want to get the vaccine because it covers several strains of HPV. It's not just going to be the one that you had on your pap smear, and you can get more than one strain of HPV.
Okay. Now, if you ended up with I know there's the different stages of cervical cancer, but if you ended up like level 1 or like kind of beginning stages, would you still say get the vaccine?
Yeah, I mean, because like I said, there's more than one strain out there, and most early stages of cervical cancer, if you have like a low grade squamous intraepithelial lesion or even a high grade one, they're usually treated, very minimally invasively, with something like a LEAP procedure or a loop where they just kind of zap off the affected part of the cervix. But you can still get other strains of HPV. Having it once doesn't make you immune to ever getting anything else.
Okay. And one last question, because I felt like this is important. When I seen your post, I was like, I'm so glad. I know this sounds good. I'm not glad that this happened to your friend, but I'm glad that you brought this up, because I feel like this is a neglected issue. And I've been like pushing, it's like in my 20s, I was like telling my friends, and they were like, I didn't even know what HPV. And I was like, please, like, listen to me about this. But this is kind of an off their question, but why do boys or males need to get this vaccine?
Because they carry it. They're the ones that spread it. I mean, women spread it too, obviously, but men and boys, you know, if they have the virus and they have sex with someone who doesn't, they will transmit it. And also keep in mind, there's women at least can get a pap test done and they can be tested for HPV. There's no screening test for men for HPV at all. So, you know, unless you have a visible genital wart, and the vast majority of people do not, there's no way to tell if a man is carrying HPV.
I kind of knew that, but I wanted you to explain.
Just because I say it out there to the world.
Yeah, because I feel like a lot of people are like, well, I have boys and I don't need to. And I'm like, because they're not going to get cervical cancer. And I'm like,
fully vaccinated.
Yeah. So that's why I wanted to ask you, because I feel like that's just a, you know, like, no, vaccinate boys too. Like
everyone.
And if you want incentive for reasons to get your boys vaccinated, as Dr. Lind said, it's implicated in oral cancers. And if you want to, you can go look up some pictures of oral cancers and oral cancer surgery. And if that does not get your butt moving, I don't know what will.
They're horrible. They're horrible. I mean, obviously any kind of cancer is terrible, but oropharyngeal cancers, the treatment, the suffering that these patients go through is horrible. I've had patients with most of their tongue removed, you know, on feeding tubes. It's terrible. It's terrible.
If you like your face the way it is, get the vaccine.
Yeah.
If you like to see your son's face the way they are, get the vaccine for them.
Yep. And for their future wives or partners of either sex.
Yeah. I was going to ask that too. I was going to say people, because I mean, I have gay brothers. So people like, oh, it's not a big deal, but I'm like, you're still
even more important. Yep. Even more important. Yep. Everyone.
I'm so glad. Like I got to ask you about this, because I've been like, this has like been one of the first questions that I ever came up with when I was like, I'm going to have people come on and like ask them questions. It's actually like in my beginner questions, like my first 10 questions, because I was like, I feel like nobody ever talks about it. And I'm like, we need to talk about it. Like it needs to be known. Like this is deadly and we can prevent it. Like, you know?
Yes, absolutely.